Good morning everyone. Myself Geeta. Today I am going to take nutritional assessment. Objectives. At the end of the class, students will be able to understand and develop a positive attitude towards it and apply the skills in clinical as well as in teaching practices. First one, define nutritional assessment. Enlist methods of nutritional assessment. List out the purposes of nutritional assessment. Explain the importance of nutritional assessment. Describe the methods of nutritional assessment. Details about role of nurse. Introduction. Nutrition is very important to maintain health and to prevent from disease and death. When illness or injury occurs, optimal nutrition is an essential factor in promoting healing and resisting infection and other complications. Assessment of nutritional status of a person provide information about obesity, malnutrition, weight loss and deficiency of specific nutrition and metabolic abnormalities. Definition. Nutritional assessment can be defined as an evaluation of nutritional status of individual through measurement of food and nutrition intake and evaluation of nutrition related health indicators. Purposes of nutritional assessment. The purposes of nutritional assessment to determine nutritional health, look for warning signs, identify risk to medical treatment and recovery, identify individuals or populations groups at risk of becoming malnourished, identify malnourished individuals or population group, to develop healthcare programs that meet the community needs which are defined by the assessment, to measure the effectiveness of the nutritional programs and interventions. Importance of nutrition assessment. Nutritional assessment helps people understand their own dietary intake and how it compares with the recommended daily allowance for nutrition. Regular nutritional assessment allows you to identify any potential risk associated with poor nutrition. It helps people make informed decisions about change to their diet. A nutritional assessment provides information about whether or not there are specific foods that you should not eat. It helps you learn how to plan meals and snacks ahead so you don't have to rely on fast food or convenience options. Regular nutritional assessment is the only way to ensure you are getting enough nutrition from your meals and in the right quantities. Methods of nutritional assessment. These are summarized as ABCD method. A stands for anthropometric method, B stands for biochemical method, C stands for clinical methods, D stands for dietary evaluation methods. First one, anthropometric measurement. According to anthropometric measurement, we are following height, weight, head circumference, mid upper arm circumference, skin fold thickness, waist circumference. Height. According to length and height, increase in height indicate skeletal growth. Yearly increments in height gradually diminished from birth to maturity. At birth, average length of the healthy Indian newborn baby is 50 cm. It increased to 60 cm at 3 months, 70 cm of 9 months and 75 cm at 1 year of age. So how they are measuring the height, you see the pictures. Height, velocity, age, birth to 3 months, approximate rate of increase in stature, 3.5 centimeter per month. 3 to 6 months, 2.0 centimeter per month. 6 to 9 months, 1.5 centimeter per month. 9 to 12 months, 1.2 centimeter per month. 1 to 3 years, 1 centimeter per month. 4 to 6 years, 3 centimeter per year. At birth, gain during first year, 25 centimeters. Gain during second year, 12.5 centimeter. Gain during third year, 7.5 to 10 centimeters. Gain during 3 to 12 years, 5 to 7.5 centimeter. At adolescent age, 8 centimeter per year for girls during 12 to 16 years, 10 centimeters per year for boys during 14 to 18 years. Weight. Weight is one of the best criteria for assessment of growth and good indicator of health and nutritional status of child. Among Indian children, weight of the full-term neonate at birth is approximately 2.5 kg to 3.5 kg. There is about 10% of loss of weight first week of life, which regains by 10 days of age. The head circumference. It's related to brain growth and development of intracranial value. Average head circumference measured about 35 cm at birth. At 3 months, it is about 40 cm, 6 months, 43 cm, 1 year, 45 cm, 2 years, 48 cm, at 7 years, 50 cm, and 12 years, about 52 cm. Almost same year adult age. Why we want to check head circumference? We want to identify microcephaly and macrocephaly. Etiology of macrocephaly and microcephaly. Macrocephaly, hydrocephalus, family and genetic history, brain tumor, intracranial bleeding, chronic hematomas, Ruller syndrome, Canavan disease, Mackay syndrome. Microcephaly, chromosomal disorders, maternal viral infections, maternal diabetes, sepsis in newborn, maternal alcoholism, mercury poisoning, maternal malnutrition, lack of oxygen. Mid-upper arm circumference, there are Bangle test and Shaget tape test. According to Bangle test, it should be quick assessment. A fiberglass ring of internal diameter of 4 cm slipped up arm and passes above the elbow. It suggests upper arm is less than 12.5 cm and child is malnourished. Shaget tape method, fiberglass tape with red color showing less than 12.5 cm, yellow color showing 12.5 to 13.5 cm, green color showing greater than 13.5 cm. Skin fold thickness. According to skin fold thickness measured with Urbanson caliper, triceps or subscapular region, the skin fold with subcutaneous fat is picked up with the thumb and index finger and caliper is applied beyond the pitch. Fat thickness are measured by above 10 mm healthy children around 1 to 6 years. Below 6 mm is indicate of moderate to severe degree of malnutrition. Weight circumference is measured at the level of umbilicus to the nearest 0.5 cm. Subject have to stand erect with relaxed abdominal muscles, arms at the side and feet together. The measurement should be taken at the end of the normal expiration. There are two levels risk have been identified. Level 1, males above 94 cm, female above 80 cm. Level 2, males above 102 cm, female above 88 cm. The body mass index according to obesity level, underweight more than 18.5, Normal 18.5 to 24.9, overweight 25 to 29.9, obese 30 to 34.9, extremely obese above the 35. Advantages and disadvantages of anthropometric measurement. Advantages: objectives with high specificity and sensitivity, measure many variables of nutritional significance. Reading are numerical and gradable on standards growth chart. Readings are reproducible, non-exposure and need minimal training. The limitations are inter-observer error in measurement, limited nutritional diagnosis, problem with reference standards, arbitrary statistical cut-off level of considered abnormal values. Biochemical assessment. Biochemical assessment involves checking the level of nutrition in a person's blood, urine or stool, usually through lab test. These lab tests can help trained medical practitioner discover any medical problem affecting your nutritional status or appetite. For example, lab science might take your blood sample to measure level of glucose level in your body. Advantages and disadvantages of biochemical assessment. It is useful in detecting early changes in body metabolism and nutrition before the appearance of overt clinical signs. It is precise, accurate and reproducible. It is useful to validate data obtained from dietary method. For example, comparing salt intake with 24 hours urinary excretion. Limitations are time consuming, expensive. They cannot be applied on large scale. Needs trained personnel and facilities. Clinical nutritional assessment. The clinical methods of assessing nutritional status involve checking signs of deficiency at specific place on the body, asking the question patients whether they have any symptoms that might suggest nutrition deficiency from the patient. Assess the clinical signs are pallor, bite or spot, pitting edema, goiter and severe visible wasting. The advantages and disadvantages of clinical nutritional assessment. Advantages: fast and easy to perform, inexpensive, non-invasive. Limitations are do not detect yearly cases. Dietary assessment. The dietary assessment is the process of collecting information about what a person eats and intake over a period of time. In other words, it is a record of food one eats in attempt to calculate their potential nutrition intake. During a dietary assessment, the health practitioner analyzes the energy, nutrition and other dietary constitute using food composition tables. The goal of dietary assessment is to identify appropriate and actionable areas of change in the patient's diet and lifestyle and to promote the overall well-being of the patients. For a detailed analysis, the health practitioner can deploy one or more of these methods. There are diet record, 24 hours recall, food frequency questionnaire. Advantages and disadvantages of dietary assessment. Advantages: it provides contextual information about person nutritional intake. Results from the dietary assessment are largely accurate due to more detailed description of food and portion size. Disadvantages: it relies on accurate recall of dietary intake over a long period of time. It prone to misreporting, especially when the health practitioner adopt food frequency questionnaire for the data. Thank you.